Before we talk about Overdose, let's talk briefly about Elvis Aaron Presley. Profession: singer and cultural icon. Nationality: American. Biography: one of the most significant cultural icons of the 20th century, Elvis helped establish the emerging rock and roll sound, incorporating blues and gospel influences. He was also a leader in popularizing both the rockabilly sound and the four-man band lineup which would later dominate the music industry. His first single, Heartbreak Hotel, 1956, began a string of number ones that radically reshaped American music and put Presley at the forefront of rock and roll. In 1958 he was drafted into the army and served in West Germany. Following this he began a much derided acting career and did not perform live for 7 years. In 1968 he returned to the stage with the acclaimed Elvis Special, and then took up an extended Las Vegas residency which became iconic in its own right. A series of successful concert tours followed, as did the 1973 live concert special, Aloha from Hawaii, which was a technological first. On August 16, 1977, Presley died of a heart attack at his Graceland estate in Memphis, often considered to be the result of an accidental prescription drug overdose. Presley is one of the best-selling artists in music history, with sales of over 600 million units. Born January 8, 1935. Birthplace: Tupelo, Mississippi, USA. Generation: silent generation. Died August 16, 1977, aged 42. Cause of death: heart attack caused by a suspected but disputed overdose of prescription drugs. Let's talk about overdose. What is it and what are the symptoms? How many people die from overdose according to statistics? How can it be treated and prevented? Is overdose fatal? And other questions will be answered. Finish this video to find out the answers. The word overdose implies that there is a common safe dosage and usage for the drug. Therefore, the term is commonly applied only to drugs, not poisons, even though many poisons as well are harmless at a low enough dosage. Drug overdose is sometimes used as a means to commit suicide, as the result of intentional or unintentional misuse of medication. Intentional misuse leading to overdose can include using prescribed or non-prescribed drugs in excessive quantities in an attempt to produce euphoria. Usage of illicit drugs, in large quantities, or after a period of drug abstinence can also induce overdose. Cocaine and opioid users who inject intravenously can easily overdose accidentally, as the margin between a pleasurable drug sensation and an overdose is small. Unintentional misuse can include errors in dosage caused by failure to read or understand product labels. Accidental overdoses may also be the result of overprescription, failure to recognize a drug's active ingredient, or unwitting ingestion by children. A common unintentional overdose in young children involves multivitamins containing iron. The term overdose is often misused as a descriptor for adverse drug reactions or negative drug interactions due to mixing multiple drugs simultaneously. Overdose happens when your body is overwhelmed with a toxic amount of a substance or combination of substances. You can overdose on different substances like alcohol, medications, and other non-prescribed drugs. This can sometimes also involve herbal remedies. Your risk of overdose increases when you take more than one of these substances at a time, or if your body is not used to taking a substance. An overdose is when you take a toxic, poisonous amount of a drug or medicine. Symptoms of an overdose can occur rapidly, but sometimes people can experience a delay in symptoms. Not all overdoses are fatal or life-threatening, however medical advice should always be sought if overdose is suspected or has occurred. Epidemiology and statistics. The UN gives a figure of 300,000 deaths per year in the world through drug overdose. 1,015,060 U.S. residents died from drug overdoses from 1968 to 2019. 22 people out of every 100,000 died from drug overdoses in 2019 in the U.S. From 1999 to February 2019 in the United States, more than 770,000 people have died from drug overdoses. In the U.S., around 107,500 people died in the 12-month period ending August 31, 2022, at a rate of 294 deaths per day. 70,630 people died from drug overdoses in 2019. The U.S. drug overdose death rate has gone from 2.5 per 100,000 people in 1968 to 21.5 per 100,000 in 2019. The National Center for Health Statistics reports that 19,250 people died of accidental poisoning in the U.S. in the year 2004, 8 deaths per 100,000 population. In 2008 testimony before a Senate subcommittee, Leonard J. Polizzi, a medical epidemiologist at the Centers for Disease Control and Prevention, said that in 2005 more than 22,000 American people died due to overdoses, and the number is growing rapidly. Polizzi also testified that all available evidence suggests unintentional overdose deaths are related to the increasing use of prescription drugs, especially opioid painkillers. However, the vast majority of overdoses are also attributable to alcohol. It is very rare for a victim of an overdose to have consumed just one drug. Most overdoses occur when drugs are ingested in combination with alcohol. Drug overdose was the leading cause of injury death in 2013. Among people 25 to 64 years old, drug overdose caused more deaths than motor vehicle traffic crashes. There were 43,982 drug overdose deaths in the United States in 2013. Of these, 22,767, 51.8%, were related to prescription drugs. Signs and symptoms. Signs and symptoms of an overdose vary depending on the drug or exposure to toxins. The symptoms can often be divided into differing toxidromes. This can help one determine what class of drug or toxin is causing the difficulties. Symptoms of opioid overdoses include slow breathing, heart rate and pulse. Opioid overdoses can also cause pinpoint pupils, and blue lips and nails due to low levels of oxygen in the blood. A person experiencing an opioid overdose might also have muscle spasms, seizures and decreased consciousness. A person experiencing an opiate overdose usually will not wake up, even if their name is called or they are shaken vigorously. Substances that people can overdose on include alcohol, prescription medications, over-the-counter non-prescription medications, illicit drugs, some herbal remedies. Symptoms of overdose. A wide range of signs and symptoms can occur when a person overdoses, and everyone responds differently. Signs and symptoms depend on a variety of factors including which substance or substances they took, how much they took, the strength of the drug, how they took it, their state of health, their age. Symptoms of a drug overdose including alcohol poisoning may include nausea and vomiting, severe stomach pain and abdominal cramps, diarrhea, chest pain, dizziness, loss of balance, loss of coordination, being unresponsive but awake, limp body, seizures, fitting, drowsiness and confusion, agitation, paranoia, slow or erratic pulse, difficulty breathing, shallow or erratic breathing or not breathing at all, hallucination, visual disturbances, choking or gurgling sounds, snoring deeply, blue fingernails or lips, pale or clammy face, loss of consciousness. The Alcohol and Drug Foundation has more information about different types of drugs, their effects and risk factors. First aid for overdose. If you think someone has taken an overdose, try your best to stay calm. If the person is unconscious but breathing, place them gently on their side in the recovery position. Ensure their airway remains open by tilting the head back and lifting the chin. This can help them to breathe and stop them from choking if they vomit. Check breathing and monitor their condition until help arrives. Do not try to make the person vomit. Do not give them anything to eat or drink. Keep any pill containers to take to the hospital. An overdose can still be an emergency, even if the person seems okay at first. Consider first aid and naloxone training for an overdose response. Some knowledge of basic first aid could mean the difference between life and death in an emergency. Consider a first aid course, so that you will be able to manage if someone is injured or becomes ill. Now, let's give an example. Paracetamol overdose. Paracetamol is a common form of pain management and is also used to reduce fever. It is usually bought over the counter without a prescription. It is one of the most common medicines taken by young children in an accidental overdose. Paracetamol is also commonly taken by people who intend to harm themselves, suicide attempts. Signs of paracetamol overdose include drowsiness, coma, seizures, abdominal pain, nausea, vomiting. Another name for paracetamol is acetaminophen. There is only a small difference between the maximum daily dose of paracetamol and an overdose, which can cause liver damage. Large amounts of paracetamol are very dangerous, but the effects often don't show until about 2 to 3 days after taking the tablets. Treatment must start early to be effective, before the effects begin. Always seek treatment for paracetamol overdose immediately, even if the person seems well. Treatment. Medical care for overdose depends on the drug or drugs taken, the dose, when and how the drug was taken, what else it was taken with, the effect on the person, including any medical complications resulting from the overdose. If you go to hospital for a suspected drug overdose, the healthcare team will typically perform a full assessment in the emergency department, which may include blood tests, observation and psychological review. Why an overdose might happen. Sometimes it's unclear if an overdose was accidental or intentional. There may be elements of both. Regardless of why the overdose happened, it's important to treat people who have experienced an overdose with care and dignity. Accidental, if a person takes the wrong substance or combination of substances in the wrong amount or at the wrong time without knowing that it could cause them harm. This may include people who take a drug to get a certain desired effect, for example to get high, or reduce unpleasant emotions, but don't realize the strength or ingredients of what they're taking. Intentional, a person who takes an intentionally harmful dose of a substance or combination of substances. This can be sign of physical, emotional, or internal distress, and highlight the need for some additional care and support. Overdose risk factors. People of any age may overdose. Your risk factors for drug-related harm is increased when more than one substance is taken at the same time. The body is not used to taking a certain substance. Preventing overdose. Some ways to help prevent an overdose include practice medicine safety. Always read medication labels carefully. Take prescription medications only as directed. Keep all medications in their original packaging. Tell your doctor or other health professional if you have had an overdose before. Do not keep medications you no longer need. Return them to the pharmacist. Keep all medicines, alcohol, drugs and poisons locked away in a safe, secure place and out of reach of children. Be careful when taking different substances, including alcohol, at the same time. They can interact negatively and increase your risk of overdose. Ask your doctor or pharmacist if there are any interactions you should be aware of. Safer use. There is no safe level of drug use. Use of any drug carries some risk. If you do choose to use a substance, here are some ways to keep you safer from overdose. Start low and go slow. If you haven't used a drug, such as heroin, for a while, your tolerance is likely to be a lot lower than it was before. Take it slow and start with a smaller amount. If using drugs from an unknown source or of unknown purity, have a smaller test amount at first. If you have any unexpected or delayed reaction to a drug, do not take more. Make sure you're in a safe environment with people you trust. Try to avoid using alone. Let someone know where you are and what you are doing, or have a friend with you. Management. Stabilization of the person's airway, breathing, and circulation (ABCs) is the initial treatment of an overdose. Ventilation is considered when there is a low respiratory rate or when blood gases show the person to be hypoxic. Monitoring of the patient should continue before and throughout the treatment process, with particular attention to temperature, pulse, respiratory rate, blood pressure, urine output, electrocardiography (ECG), and O2 saturation. Poison control centers and medical toxicologists are available in many areas to provide guidance in overdoses both to physicians and to the general public. Disclaimer: this channel is not intended to replace professional medical advice. It only provides information to help you gain health knowledge. However, to be more certain, it is still recommended to consult with professionals. If you like such informative topics, you can subscribe to stay tuned for my future videos. Thank you for watching.